Again, gentlemen, we are just now letting the attendees in, opening the floor to let them in. We apologize again for the technical difficulties. We are experiencing extremely severe rains here in Abidjan, and it is affecting our connections. So, greetings and welcome again. We will wait just to have as many attendees back in the room as possible. We'll give it just one more minute and we will start. And thank you for your patience. And to all our attendees who are already online, we would like to apologize for the delays that we are experiencing. We are having very severe rain in Abidjan, and it is affecting both electricity and connections. So please bear with us, and we hope that it will remain stable until we have completed our webinar. We now have 8 attendees, and I will go ahead and start. Greetings, everybody. Welcome to the African Water Association's webinar on information technology. The African Water Association, first, I will tell you what that is. We are an organization, an association of water and sanitation utilities, primarily. Some of our members are also industrial suppliers of the water and sanitation utilities. Some of our members are academic institutions. Some of our members are governmental institutions by way of governance, as well as actors in the communities, such as municipalities. And then we also have individual members. So we all work to ensure that the African population is receiving quality drinking water and quality sanitation services, and working very hard and fast towards both the SDG 6 goals as well as our own commitments to make water and sanitation accessible to a broader population throughout the continent. So welcome to our webinar on information technology. This forum we actually invited is a forum that will help us reflect on how water utilities technology departments have been affected by the outbreak of the COVID-19 and how they have operated within their different water utilities to support the utility on the one hand, and also to overcome some of the challenges that the utility had to face. I have here with me on the panel today, and will ask all attendees to help me welcome Mr. Philiphs ALEER, who's the Acting Director General for Information Management Systems in South Sudan at the South Sudan Urban Water Corporation. Please help me welcome also Mr. Mandla Saul MALAKOANA, who's a corporate communications strategist at Etiquette Water Sanitation in South Africa. And last but not least, I would like you to please help welcome Mr. Stanley MARTEY, who's the head of public relations and communication at the Ghana Water Company Limited. Gentlemen, welcome. I would like to go on with the first question, which I will ask each of the panelists to please answer. And you've got 4 minutes for your answer. And you will just hear a bit of an alarm go on when you are, your time is up. What actions have been taken by governments and your particular utility within the context of the COVID-19? And how have you responded to these actions at the social level? So I would like to please ask Mr. ALEER to please answer the question first, if you will.
Good evening, everybody. It's evening time where I am, South Sudan. Greetings from South Sudan to everyone, both the panelists and the attendees. I would go straight to the point. The thing is, the actions that have been taken by the government. Our country, fortunately, was one of the countries that contracted COVID-19 at a very late stage, almost one of the last countries in Africa. So we stayed for long without big measures being done, though the borders were blocked. And when we got our cases, first cases of COVID-19, there was a presidential order which was circulated, reducing the working hours from 9 p.m. to 1 p.m. After 1 p.m., everybody is expected to go home. With that presidential order, non-essential workers were supposed to go home at 1, and then the essential high-level officers, the level of the directors, the director generals, were to stay in the offices until late hours, until 5 p.m. So nothing much was done because there were no total lockdown. The staff were still coming back to work as usual. So there was communication between people when you come. Though there was social distancing, but there has been regular communication. You can walk into somebody's office and you discuss a few things that you would like to discuss. Though you keep a distance and you wear your protective equipment like the mask and the gloves not to get contaminated. And so that's what has been done, and that's what the government did, and that's what the utility did. In terms of emergency, there has been no emergency communication strategies done since the offices were open and the facilities were all open for each and everybody. So in case you want to communicate to a certain department, you will still do it, and then you plan on how to execute the other tasks accordingly. And then the human resources on course, and then the general management is also ongoing well. Though some of the officers were locked down in different countries, we have some of the people locked down in Uganda, some locked down in Kenya, other one in Zambia. But we're still using online facilities like the WhatsApp, emails, and the Zoom conference, like what we have right now. So this is what it has been. That's what has been going on, and that is the situation we're in. So we've been adapting well. So at some point we're not that badly off in the fight of COVID-19 in terms of communication. The communications are still ongoing as usual because offices are still open. Thank you. I would end there for the sake of that question.
Thank you very, very much. Thank you for your answer, Mr. Lee. I would like to please invite Mr. Malaka. Mr. MALAKOANA, would you please answer the question for the audience?
No, greetings from South Africa, Etegwini municipality. Let me start off by saying communication, like science, is real science, and communicating requires some art in its execution to circumvent any wrong information being conveyed and disseminated. It cannot be done with some feeble sentimentality. In this presentation, as it has been stated earlier on, one is going to be addressing the question of how we have been able to use this science of communication as the organization at Etegwini Water and Sanitation during the COVID-19 adversity. Let me start off by actually stating that we as an organization are at liberty or have a lack of always doing the having the annual communications plan in place every year. We always make it a point that we implement that communications plan. So this year, in November, we started implementing the communications plan that we have in place in collaboration with the city's communications unit and also the political leadership to communicate with the various stakeholders. Of course, after hearing of the COVID-19, national government was on extreme high alert because the national government needed to sensitize all of us of the gravity of the situation. So there was a necessity to communicate more with promptness, but factually and also internally as an organization, we communicated with the employees regularly and also doing that with integrity and honesty and ensuring that there is some sense of authority, educating them about the virus because national government had already started giving us information on what the virus was about and on what the COVID-19 was about. And we constantly updated the employees using the social networks, the social media, your Zoom, your Teams, your webinar, on the importance of wearing a mask and also ensuring that there is a social distancing, there is the constant washing of hands and also sanitizing with a view of ensuring that indeed there wasn't any movement of the virus. But there was a time when there was an institution of level 5 lockdown by the national government. So at that time, the national communication campaign was intensified, and we also intensified our campaign, our communication campaign internally on what the virus was, on what needed to be done to reduce the spread of the virus, on the information filtered, the information that was filtered from the province and the national. We are an essential service. As such, we had to determine the core staff and that needed to remain on the system, but we constantly kept on giving the information to all and sundry within the organization and also externally categorizing the staff in terms of those who were above the age of 60 and also who might have the comorbidities to work from home based on the various stages of the lockdown following the strict regulations. But of course, as an organization, we do have the disaster and drought management strategy in place for the city, which we use both internally and externally for the external and internal customers. And it became easier for us to actually convey and communicate the information at that level. But the central point of departure was our contact center, because all of this, some of the staff were not operating from the main base, as we had to work with the limited number of staff and also with the limited contact with the customers. So that was our gist.
Thank you. Thank you so much, Mr. MALAKOANA, for your answer. Before I pass the mic on to Mr. Marley, I just want to clarify again for our audience that we are indeed talking about how communication has been internally and externally managed at the water and sanitation utilities. Mr. Marley, you have the mic to please answer the first question. Thank you. Welcome.
Yeah, thank you very much to my colleagues for the good work done. And I think we've all been doing almost the same. It's the same stuff. So in Ghana, just at the beginning of March, this COVID became a bit serious. So the only thing and the most prudent thing to do was to call all staff to the open ground for a meeting and to let them know strategies that management has put in place. So we have our communications plan, and we had to establish our crisis management team and operational team as well. That will be working during that period, because we needed to decongest the office as well. So what we did was to initially allow national service personnel or non-essential service workers to all stay home, so that we could decongest the office. And then we had to put all communication strategies in place. The communications crisis team was led by myself personally. So we drew our communications plan and we started implementing immediately. So we had to do some education to staff, make them aware of the COVID and its mode of transmission and how we can curb it. So that one of the things that we did was to put up at strategic locations water containers where staff could wash their hands regularly and with soap. And then we had sanitizers all over on each floor, on almost at all the staircases. We had sanitizers. So before staff could enter the office. They are checked, their temperatures are checked, they make sure their hands are washed and sanitized. And then all guests also go through the same processes. So beyond a certain limit, you are not allowed to come in. If your temperature is beyond 37.5, you are not allowed to come in at all. And we were also asked to reduce the number of visitors that came in. So we had educational materials pasted all around the offices. Every door had no marks, no entry sticker, and sanitizers, like I said initially, was all around. Now the government, we also needed to reduce the movement of our staff. In Ghana, we have meter readers who go around customer premises to read meters so that we could bill them. So what we did was to send out a press release to all our customers via all channels to tell them that we were going to reduce the movement of our meter readers. So instead of coming around monthly to bill them, we were going to use an average of their first 3 months consumption of the year. So each customer was going to be billed on January, on that average of their consumption of January, February, and March. And we're going to bill them like that till the situation normalizes. But I think 2 weeks into March, there was a lockdown, but the essential service providers like the Ghana Water Company Limited staff were still supposed to work. So, and then the president also announced that we should give out water to each citizen for free, and the government was going to pay for that as well. So the government came out with a policy, and we needed to sit and to strategize as to how we could implement that. So the operational team and then the crisis management team sat down to work out modalities, and we needed to communicate to all let's say all customers. So we did that, and we needed to explain we're all over. Okay, so these are some of the things that we did internally to curb the situation. Thank you.
Thank you very much for communicating all of that, what your utility has actually done and what measures the government has taken, Mr. Marley. And I will ask you to then go on to answer first, let's first intervene the second question, which is more about the external communication of water and sanitation utilities. Now, we know that transmission occurs through contact, and your utilities are bound to have customers come and go, and so are exposed to contact, and you've pretty much explained what some of the measures that have been taken. But this particular question, you've also answered some of your communications in that regards, but can you be a little more precise? And for all of you, can you please give us with more detail how your actual function, okay, communications management function, maintain communication with the customers while minimizing the risk of contagion? Mr. Marley.
Yes, thank you for the question. Yes, we deployed all channels in our communications process. So because we went on a lockdown and all citizens were supposed to stay indoors, we realized that social media was also going to be very effective. So we're using social media and all other channels to communicate to our customers. So we issued out press releases, we issued out announcements, we issued out soft copies of flyers on social media, and we have done all those things to reach out to customers as to every stage of the process, how things were going. So it was quite easy for customers to get information and to give us a feedback. And because we were also allowed as essential service providers to move around, it was easy to still work and to rectify the challenges that customers faced. So this is what I can say for now. And the president also, like I said initially, the president also gave out the free water to staff, to all customers. So we needed to even up our production so that we could get more water into the system. One of the things that we also did was to reconnect most of our customers who had been disconnected so that they all could have access to water and to keep themselves clean and to keep themselves healthy as well. So we had deployed all channels, including social media, TV, radio, and we were all over communicating and educating our external customers as to how they can get water and to keep themselves clean. Thank you.
Thank you very much, Mr. Marley, for that answer. I would like to now ask Mr. Lee to provide us with an answer to that second question, please. Mr. Lee, the mic is yours.
Okay, thank you once again. Since we've been working, since we've not gone under total lockdown, customers were able to reach us through our sale points. And whenever they come, we have posters around, posters which are instructions brought by the Ministry of Health, guidance also in collaboration with the World Health Organization of what to do. Of course, we will have hand washing basins, containers outside with soap, and then the disinfectants, and a mask and a social distancing. So this is how we've been able to communicate with our customers and make sure that we provide them with the services that they need. When our meter readers go outside to read meters, they also ensure that they wear the gloves so that they don't get to touch things that are being handled by someone who might be infected. So this is how we've been handling. So far, we've not been affected so much. We've been affected, of course, but our operation has been ongoing because of the government policy. The government policy is that people work until 1, and essential workers like us, you still work. People move around. You move around even up to 5, up to 6, 7, 8. You still move around. So if you have something to do, you can still do it, and then later on you hand it over and you go back home. So we've been using personal protective equipment to keep ourselves safe and find a way of also keeping our customers safe in the process of providing them with the services. Yeah, thank you.
Thank you very, very much, Mr. Lee, for your answers. I'd like to now give the floor to Mr. MALAKOANA. If you would please answer our second question.
Thank you very much, Chairperson. In our case, we always recognize the fact that communication is a two-way street, and the principle of reciprocity remains vital and key. And in anything that we do, we recognize the importance of creating a dialogue with the internal customers and also equally with the external customers. What we did moving towards the lockdown and towards the COVID-19 when it intensified, like I said earlier on, we always have that annual communications plan which we always implement. We used the mass media intensively and very intensely to inform the public via the electronic, print and other forms of communication. We used about 8 community radio stations plus 3 national radio stations and 1 national television station. We also used about 8 community newspapers plus 3 national newspapers, and more than anything else, we actually used the internal modes of communication, but the key messages were being led by our political leadership and the head of the organization, Ms. Ethnic Msweli, because we recognize the importance of authority in any information that we communicate. When they were talking and the messages that we conveyed were fundamentally based on the importance of hygiene, the washing of hands and the wearing of masks, and not sending kids to fetch water from the water tankers, even the importance of social distancing when fetching water from the water tankers for those people who would be fetching water from the water tankers. And also we granted our customers a 3 months payment relief with no disconnections, no any interest accrued on any account, because we recognize the fact that the entire country was on lockdown, and those customers who could afford were encouraged via the media to say they needed to continue paying for their monthly bills so that we could actually maintain our financial viability. And the last one was just to ensure that en masse we just intensified the use of radio, the use of the website, even our website, and also other forms of communication. But we have been there from November up until now. We are still talking. Our messages are still being conveyed.
Mandla, you're the host now.
Well, I've concluded on the points that we were doing in terms of the key decisions that were taken by our utility, and also on the principles that we implemented, and the channels that we were able to implement. So, like I was just covering exactly on what it was that we did and that we have been doing, which we are still even doing now, because we say there will never be any time whereby we cannot give information to the members of the public and also to the staff internally, because if we are to succeed in dealing with the scourge of the COVID-19 pandemic, it is through information, and more information, and through repetition, and more repetition. Because if we cannot do that, we cannot actually succeed in making people aware of the dangers and the gravity of the situation. Probably, I'm not so sure if we could be actually moving to the third question that we had actually been informed of. I'm not so sure if we can also continue discussing about the second question we've been dealing with. Yes, the other participants must be aware of what we're going to be talking about. Probably we could actually move on to talking about our own institutional communication as to how we went about in terms of ensuring that all of the staff members were aware and well informed, not only the staff members, but also the public, the general communities.
Okay, so one other thing that we also did in Ghana was to encourage staff members who could work from home to work from home. So we made sure that all tools that needed or that were essential for them to work from home, we make sure that everything was okay for them to work from home. So their laptops, data for them to work from home, and then those who also had underlying health challenges were also requested to either work from home or to stay home and not to come to the office at all. So all these things we put in place so that we could curb the situation. So one, all tools were provided. Two, people were asked to stay home and to work from home, and then the social distancing thing, at least for us, we requested that a minimum of 1.5 meters should be kept between you and whoever you're communicating with. So whether you're outside the office or whether you're within the office, we needed to follow that directive, because the company needs you alive. The company needs you to be healthy. So even if you are not in the office, the expectation is that you still will manage yourself very well so that you can be productive to the company. So these are some of the things that we also did. And then we had to be going around with our minister. So actually we risked our lives because we're essential service providers. We risked our lives, and we had to be going around educating. Although people were on lockdown and were in their homes, we were out there producing water, moving around, educating our consumers, telling them of the new directives, and making sure that they were serving other customers who were deprived with water for free. Because the president has requested that we give out the water for free, but the government was going to settle our bills. So those who didn't have connections in their homes and were going to neighbors or other vendors to buy water, we had made sure that all those vendors were giving water out free so that people could have access to free water. And this has lasted for the past 3 months. And the president's directive was that it was supposed to end in June. So we are hoping that by June, that will come to an end, and then we all may have been used to the situation, so we'll be able to manage ourselves. Now, some of the things that, one other thing that the government did was to make sure that we had provided other reservoirs or receptacles within the communities. So throughout the country, we had provided a lot of reservoirs around, and we're filling these reservoirs with water tankers so that those who lived in deprived situations and didn't have water could visit these reservoirs and to fetch the water for free. One of us can also take that out, and then we continue from there.
Well, let me continue. Philiphs will come after me. In our case, institutionally, there's been a very significant reduction of mass gatherings and meetings as a result of the gravity of the COVID-19, of the pandemic. As such, we actually resorted to the use of using extensively the electronic, like I said, and print media in all dialects. And what I'm happy about is that we have been able to have at any given moment in time a mass reach of not less than 14 million listeners. And the political leadership and also the administrative leadership committed themselves to spending not less than 7.8 million rands. It's about $460,000 US for 7 months, starting from November right up to now. We're still talking on radio, on different radio stations, on different media platforms, and internally we have maximized and intensified on the use of the social media platforms to keep the staff abreast of the developments and regular testing of essential staff, because we did recognize that if we couldn't actually do that, our existence would be as good as useless. And if anyone comes to our establishment, every time we make it a point that there is that test in terms of using the infrared or laser thermometer. And the vulnerable communities internally were prioritized for mass testing, because the information had to be communicated extensively through the mass media related to the steps to be followed in case of any symptoms, not only internally, but also externally, because we are serving the public. We are not here just in the private business. And of importance, we set up the protocols for quarantine or maybe isolation areas, which we designed and circulated to all of the staff so that they would be properly apprised of where they could actually go to in the event anyone were to be found to have actually been infected. And also, we have intensified on the use of the IT platforms such as the Zoom, the webinar, the Teams. No meeting is being held now on one-to-one, no at any gathering. We just hold our meetings on Teams, and we use our meetings, we use those platforms to communicate with our staff. And of course, externally, we communicate through the other forms of media I've spoken about. And of importance, our senior management, with myself included, visited all key points, all key strategic points of our utility to ensure that there was compliance with the protocols and show visibility and ascertain staff that they were being supported by their management. In the event one identified any weakness or any frailty within the system, we were quick to identify that and ensure that that was corrected. That's the process we're still continuing to use in terms of our own institutional communication.
I have now a third question. In the face of all these challenges, how did your utilities manage to maintain a corporate brand? Were you bruised by the challenges by way of image, or how did you emerge or survive, from a strictly communications angle? And I will ask perhaps Mr. MALAKOANA to start answering that question, please. Thank you.
Thank you very much, Chair. Let me start off by saying there isn't anything the citizens like more than knowing that when you communicate with them, you do that with authority, you do that with integrity, you do that with honesty. So we have actually recognized the fundamental principle of communication, and also for persuasion in the link of communication, the principle of reciprocity, the principle of recognizing that when we talk either on air, on radio, or on the print media, people are able to reciprocate, and we always encourage them to tell it to us like it is. When it hurts, we have to hear it. When it's an approbation of some sort, we need to know about it. In what we have done, we have actually recognized that there's been a significant reduction of mass gatherings and meetings as a result of the pandemic, and that actually called upon all of us to devise some ways and means, new ways and means of communicating. But of course, we have been consistently doing that. So we intensified on the use of electronic and print media in all dialects. Well, we are talking right now on about 11 radio stations, both print and electronic, both community and national, and also about 11 print newspapers. It's about 14 million listeners at any given point in time, to the tune of about 7.8 million rands. That's about $460,000 US for the 7 months ever since we started in November. And internally, we have maximized and intensified on the use of the social media platforms to keep the staff abreast of the developments and regular testing of essential staff. And we have actually made use of the infrared laser thermometer for anyone coming onto our own establishment. And the vulnerable communities had to be prioritized, not only for the external publics, but also for our own internal staff for mass testing, because we needed to continue communicating information extensively so that there could not be any exposure of any sort. And there needed to be the following of the protocols which we set up, we put in place based on the isolation areas designed for the staff in case they could actually contract any virus. And the last but one point which we emphasized upon was the intensity and the intensification of the use of the IT platforms such as your Zoom, your webinar, your Teams, because there isn't anyone who's allowed now to actually hold a one-on-one meeting. What we do, we just communicate on Teams, on Zoom. And the last point to make on this one, which has worked, by the way, the senior management of this organization visited all of the key points of our utility to ensure compliance, not only with the protocols, but also to ensure that there was enough visibility and staff could realize that they are being supported at our own level by us going to them and giving them information, and also ensuring that they hear the information from the print media, the electronic media, and from the television sets. And that's what we have done up to so far. We have just expanded our tentacles of communication.
Thank you so much. I appreciate you're giving all these details, and I know we're running short on time and are experiencing a lot of challenges today around time, but I do appreciate your details in light of the fact that the sanitation utilities really don't have the same problems as the clean water supplier utilities. And so I understand that your utility made a tremendous effort and manifestly did not have a brand that really suffered tremendously from the COVID, quite the opposite. It may have been even an opportunity, and you'll have a chance to tell us more about that down the road as we finish. I'd like to invite Mr. Marley to please answer the question. Mr. Marley, the floor is yours.
Okay, so thank you very, very much. And for us, we still kept faith with our customers, and we made sure that our call center, we have a call center, and a state-of-the-art call center where we have toll-free lines so that customers can call in for free. So we made sure that everything was very well in place. They had all the tools that they needed, made sure that they were in order so that customers could call in. We also made sure that we were very prompt with our social media communications, because the country was on lockdown, or the major cities were on lockdown, people were going to be at home, and people were mainly going to be on their phones and especially on social media. So we made sure that we're very prompt with communications and interactions on our social media pages. And then we also made ourselves available, the communications team. Actually, the communications team even included our sector minister, that is our Minister for Sanitation and Water Resources. She herself was part of the communications team. The managing director for Ghana Water Company Limited was also part of the communications team. And then myself, the head of communications. I also have my colleagues in the other regions who were also working around the clock to make sure that we were communicating at any point in time. So you can imagine how accessible and how available we were as a people to be in touch with our customers. Now, we also made sure, I mean, the underlying principle, underlying thing is that customers need water, okay? So if you're communicating and there's no water, then it's also another challenge. So we made sure that water was available. And we were working from the production centers, we were working, making sure that water was flowing. Our operational team were on the ground, making sure that all repairs were done. And we're also making sure that I think at the time, but then our operations team was available at all times, making sure that there's water within the communities. Our repairs were done within, the response time was very, very quick, making sure that everything was done so that people could have access to water. Thank you.
Thank you, Mr. Marley. And I appreciate you insisting on the details, and I think it's quite important to emphasize for our audience, as you did, how the actual need to continue the services needs to be seriously backed up with a really, really good communications plan. Obviously, you pulled a heavy hitter on public relations there, and congratulations to you. I'd like to invite Mr. Leek to please answer the question for us.
Thank you so much. Like I said earlier on, we've not been subjected to total lockdown, which means that our staff, technical staff from the accounts, from the distribution, from the laboratory, from the commercial customer service, they've been able to come to work. And for that reason, they're able to walk into our offices and get the service that they need. Those who wish to call would call, and those who wish to walk in would walk in, either to pay or seek some clarification. And for the reasons, the only thing we have to stick to, the only thing that we have to adapt to were the guidelines of social distancing and the use of personal protective equipment, things like the gloves, things like the mask, things like the hand sanitizer, and hand washing with soap before you enter any premises. So these have been the main issue that we've been able to manage our communication between us and between us and our customers also. However, the normal duties kept on going. The communication has been going on between the staff through emails and through phone calls and through you walk into an officer, go into an office, and then keep a distance away from the person you're talking to. For those that used to be so close to each other, they have to rotate, see what time they work, and otherwise others go to different offices which has a bit of more space and do their duties there. So this is how we've been trying to keep our image. Our image has been together, and of course we go on media and communicate whatever necessary actions which is supposed to be taken. The most unfortunate part about this is that we had development partners that were helping us with some extension of the water distribution networks, like the JICA. The JICA has been building a facility. Unfortunately, the Japanese staff and some of the nationals who were not South Sudanese that were on the project had to be evacuated by their respective countries. This one kept the project on hold, and this is one of the main reasons why right now our projects are on hold. We cannot do much since there's no action, there's no delegation of the job, so it's just a few report back and forth using emails and web conferencing, like the webinar we have right now, Zoom meetings, and other respective communication between the staffs. So this is how we've been trying to keep ourselves together and make sure that we're still relevant in the field, in the duties of providing water to our citizens, both in Juba and outside Juba, other towns outside Juba. So this is how the management of the corporation and the utility has been going through this issue, this challenge. Thank you.
Thank you very, very much, Mr. Lee. Thank you, gentlemen, for your answers to this question. I will now move on to the fourth question, which I will ask all of you to answer and try to stick to the 2 minutes once again. Now, there is increasing deconfinement throughout the world. And so reopening of contact, so as to say, to a certain extent. And we know that confinement with a no communication is nearly unthinkable. So within the context, thinking about confinement and the aftermath of COVID, hopefully, which COVID is here to stay for a while, as we all know, deconfinement, how do you see the future of your work? Particularly, how do you see the future of the communication link or function within your utility? How do you foresee that? What role will you have to play increasingly by way of strategic contribution, or how do you see your future? What challenges did you face throughout the COVID? And then also, how did you overcome them? And then how do you plan on staying on top of the game moving forward? I will ask Mr. MALAKOANA to please give us a first answer to that question. Mr. MALAKOANA.
Let me start off by actually saying that the biggest factor and the biggest challenge right now is the drop of revenue collection. I will just address the question after I shall have laid the foundation in terms of stating this one. And as such, our own organization had to reprioritize the city's expenditure to ensure continued supply of essential services, because if there is anything we can't compromise is the provision of the essential services. And structurally, I would say it will always be vital to actually recognize the importance of communication, because the more informed, properly informed the citizens are, the more wiser they will become in terms of how to use their own services. That's actually challenging the entire organization to set the budgets aside to enable the utility to continue operating under the new challenging normal, because this normal has become the new challenge, has become the new normal. But also, we are dealing with a rapidly expanding kind of a virus which is invisible and also remains a silent killer. So when it comes to bringing back the employees safely to the workplace, it's important that we change the entire business operation in terms of the social distancing, in terms of the provision of sanitizers, in terms of the mass to all stations, which has got an impact on the provision generally of the services. Hence, the importance of communication, and hence the importance of us as the communicators within the system, recognizing the vital elements of communication, which are to listen to the employees, which are to communicate the information with consistency, to ensure that at least we are simple and simplistic when we are doing that. And when we do that, it will assist the entire organization to know that whilst we are having the constrained budgets, but at the same time, the communication aspect is kept as an apex, and also at an apex of service delivery, because for so long, as a way of concluding, a lot of people seem not to recognize the important role that is centrally played by communication. We can actually have the grand plans, we can have the budgets, but for as long as we don't communicate about either the good work we do, about our weaknesses, our doing our work can remain as good as nothingness and can remain as good as useless. Thank you.
Thank you very much for that answer, Mr. MALAKOANA. I appreciate that. I will ask the next person, Mr. Lee, to please answer that question of how did you overcome the challenges, and how do you see your communication strategy moving forward, incorporating COVID and other types of crisis and the role of communication within your utility. Mr. Lee, you have the floor.
Thank you once again. We have a few challenges that we might have to face. We exposed the risk of contracting the disease through the meter reading of the meters, which is door to door in a regional sector, both in the Juba and in our regional offices, our regional stations. And then our also new connections, bill reading and bill distributions, new connections. These are the challenges we have, but some of the households would be hesitant to allow people enter their compounds due to risk of contracting coronavirus. These are the challenges that we will have to maintain, and then also the maintenance of the water network. Like in case there's water leakages or there is a replacement of upgrading or diversion or something of the sort. This might bring up resistance from the customers. These are the challenges, and also the implementation of the new project activities. Like right now, we have our two projects which are really redundant. We cannot do much. Some of the stocks cannot come in, and the JICA project is totally on hold until the pandemic is otherwise over or other measures are seek to live with. So these are the challenges. However, every challenge has a solution. It might be expensive for the corporation, but we will have to rapidly adopt the new technologies. The new technologies like what's happening in National Water and Sewage Corporation, I think they have more of their own softwares, their own applications that they can detect. So these applications will have to be upgraded, and the meters will have to be, they should become some kind of smart meters where you can read it using your back end in your database. So I think these are the way forward that we can live with such stuff in terms of communication. And also, whenever we generate the bills, this application should be modernized in a way that we can read the bills when our officers are seated in their offices or at their home with their machines, with the internet enabled, and then be able to disseminate the information, whether it's outstanding bill or the status, leak detection, something like that. But that could be detected from the office with less exposure to the general public. Maybe our staff could be also with the positive of the COVID, so to avoid the risk of him or her, transferring the disease to more people. It would be better that he or she works in the headquarters or in the station alone. And also the risk of getting the infection from the public also will have to be reduced. So we'll need to adapt to the new technologies which could be in the market. Some of the technologies will have to be amended, and though they might be expensive, but they have to be, something has to be looked at. So these are the ways that we recommend to work with the challenges that we face and how to solve them. Also, consistent use of protective equipment, personal protective equipment, the hand washing, the disinfectants, which are the hand sanitizers, the gloves, and the face mask. I think this one will have to go on for a little bit longer. And then the education of the population. Education of the population have to stay away from COVID-19, and if in case you get COVID-19, what do you have to do so that you can survive, or you don't have to transmit it to more people. So these are the recommendations.
I'm sorry to interrupt you a little, Mr. Lee. We are running over time and a little short of time still, but I appreciate those answers, and I would like to just ask you to give us perhaps a closing word, because you've gone extensively into the fifth question, which was what lessons does the communication services and department learn from this crisis within your utility? So you've given us a few hints at that already. If you would be so kind and give us a closing statement on that, and you've got 1 minute for that, please. The floor is yours.
Okay, my closing remark would be, it's kind of a quote, but if you can do it today, it doesn't mean that you can do it tomorrow. So I think we need to adopt to the new systems today, rather than waiting for another pandemic to come for us to be in a hurry to adopt the new challenges. The new prosperities. So this is what I would say. And thank you so much. Thank you so much for being for putting me on the list of the panelists, and I appreciate it. Thank you so much.
Well, thank you very much for your contribution, Mr. Lee. I would like Mr. Marley to please answer the question for us, which is connected to the previous one. What were the lessons learned for you, and what would be your closing remarks? Please take a minute to tell us that. Thank you.
The name actually is MARTEY. It's T-E-Y. It ends with T-E-Y.
Oh.
So I got it.
I apologize for that profusely, and we'll have to pay honorably a chicken or a cow for that mistake. Thank you for the correction, though.
That's okay.
Thank you, Mr. Marty. The floor is yours. Thank you.
Thank you so much. So I think we have learned a lot from this within this short period, and things that we have learned, I think we need to continue even when everything is changed, even if it comes to an end or it subsides. I think it's the lessons learned are things that we should continue forever. It should be part of us. Now, I think I'm sure that most people realize the essence of communications, and most of the time communications are called in at the last minute, but communication should be part of the process. So every time, everywhere, whether engineers are working or whether commercial people are working, communications must be part, and we need to ensure that. And I'm sure this has brought to the fore the essence of communication. We need to continue with that. Now, communications crisis management, I think every institution must have a crisis management team, let's say a policy for managing crisis, so that anytime there's any crisis, it is instituted or it is implemented immediately. We don't have to wait or move around, because that policy will already be there, and then we just have to deploy it, and then we work with it. I also think that we need to make ourselves available. Okay, so if this pandemic has taught us that it's essential that we make ourselves very, very available to our customers, so that anytime we are needed, we should be there telling them what is going on, what has to be done, and what the future also holds for us. Unfortunately, time is gone, but that we need to continue with the protocols. The protocols must be part of us henceforth, and we need to continue with that to keep healthy, and not only this COVID, but even for the sake of our health, and for the fact that our countries and our organizations need us to be productive and to help build our nations. Thank you very much.
Thank you again, Mr. Marty, and I have learned my lesson. My mistake, really, I apologize. I'm quite embarrassed. I wrote Mr. Marley on my paper, whereas everything says all over, typed all over Marty. So thank you for your indulgence there. I'd like to please invite Mr. MALAKOANA to give us a closing statement and let us know what were your lessons learned, and what are your closing statements. Please, the floor is yours.
This has been a very important platform for the cross-pollination of ideas, and I've marveled and I've valued it, I've treasured it. And I can conclude by saying that if we as communicators can continue putting a wet cloth on the eyes of the public, of the citizens, of the residents, we cannot win the fight of intensive information dissemination. Hence the importance of consensus building with the citizens based on the integrity, honesty, authority, and authority on the side of the politicians, and also on the side of the administrators, because the residents prefer, they always appreciate when authority is just actually led at the level of the political leadership. Two, it's important to, like Mr. MARTEY has said, to have a communication strategy in place that incorporates aspects of disaster or emergency management, because it becomes problematic if anyone would want to design that communication or emergency or disaster management strategy when the disaster is already there. Like I said, in our case, the virus found us already right in motion. At that point, moving towards concluding, having in place the pre-planned and fastidiously arranged messaging for both internal and external customers. It doesn't necessarily need that we need to put those messages when the problem is there. You know, we know that adversities do come in life at whatever time. For us, it's important to actually ensure that we are ready for those and we continuously give out information to the citizens. But a very vital point, the importance of collaboration and partnerships with major communication networks. For example, your print and electronic media, your webmasters, and all of those. Like in our case, we collaborate with our colleagues internally who are the nerve center for the broader citywide communications and the disaster management unit. The last point, ensuring that budgets are not constrained, thereby ending up distorting the message. Like Mr. Stanley has stated, in most cases, communications is just put down at the lowest level as though it is not critical. If budgets and more money can be made available, then we'll be able to win the fight, because right now it is information, and more information that is critical for the citizens and for the staff internally, that they will be empowered. Because if we cannot empower them with information due to the constraints imposed upon us through the constraints of budgets, it becomes problematic. I'd like to say thank you.
I really thank you, Mr. MALAKOANA, and I want to profusely thank all the panelists for your really, really critical input. Now, we at AFWA fully recognize, mind you, that communication is not a back office operation for the utilities. We are fully aware of that. And we also understand that communications is an area, as much as all our other technical areas, where utilities will need capacity development. So understanding that the communications is neither a back office nor a sideline operation for the water utilities, we are working on offering within the coming weeks an online training for communication professionals at our water utilities. We will most likely be able to welcome about 20 people, and you will soon see the invitations go out to those who will be invited in the first batch, and we hope to be doing this in a cyclical matter. Now, our next webinar actually will be on information technology. Thank you again to the panelists for having, one, indulged, and two, shown the true spirit of survival, no matter what, no matter which challenges. And I think you have just demonstrated why you have survived throughout COVID as a department. We lost the facilitation and you kept the floor until we were back at facilitation. So again, we understand that we are one at AFWA with our members, and we truly appreciate that. Thank you also for the patience of all the attendees who have listened to us all through the end. Thank you, and we look forward to welcoming you at our next AFWA webinar on information technology. Gentlemen, thank you.